Hello, folks, and welcome back to yet another episode of Monday Medline, where we consolidate all the happenings in the medical world and get you the best news that can change your world and help you make informed choices. And let's start with the not so good news. A recent study published by the researchers from IIT Madras has revealed a sharp uptick in the number of cesarean sections, that is C-sections, deliveries across India between 2016 and 2021. This surgical procedure, which involves making an incision in the mother's abdomen to deliver one or more infants, can be life-saving when medically justified. However, if performed unnecessarily, it can lead to adverse health outcomes, unnecessary expenditure, and strain on scarce public health resources. The study, concluded by the researchers from the Department of Humanities and Social Sciences of IIT Madras, found that the prevalence of C-section in India increased from 7.2% to 21.5% during this 5-year period. Alarmingly, in the private sector, nearly 1 in 2 deliveries, that is 49.7% in 2021, was a C-section, up from 43.1% in 2016. The study suggested that clinical need factors were not necessarily the primary reasons for the surge in surgical deliveries. Instead, non-clinical factors such as women's preference, socio-economic status, educational levels, and risk-averse physicians practicing conservative medicines could be driving this trend. Secondly, the researchers found that the likelihood of a C-section delivery was higher among better educated women living in urban areas, indicating that a greater autonomy and access to healthcare facilities might be contributing to this increase. This raises questions about the potential overuse or misuse of medical interventions, particularly in the private healthcare sector. Thirdly, the study revealed a concerning disparity between the public and the private healthcare facilities. Women delivering in private facilities were 4 times more likely to undergo a C-section compared to those in the public facilities. This gap was even more profound in the states like Chhattisgarh, where women had a 10 times higher chances of having a C-section in the private hospitals. This disparity could be attributed to a lack of adequate infrastructure and human resources in public health care facilities. For instance, in Chhattisgarh, there was a 77% vacancy against the sanctioned posts for obstetricians and gynecologists in 2021. These findings should raise a concern about the potential overuse of C-sections, particularly in the private healthcare sector. While C-section can be a life-saving in certain cases, their unnecessary use can expose mothers and infants to unavoidable risks, including increased chance of infection, bleeding, and complications in future pregnancies. Moreover, the cost of C-section deliveries can place a significant financial burden on families, especially those from the lower socio-economic backgrounds. And staying with the hospital and its issues, in a move aimed at improving the cleanliness and hygiene standards in government hospitals across Rajasthan, the State Health Department has made it mandatory to implement a QR code-based cleaning system. This innovative system will empower patients and their attendees to raise complaints regarding the improper cleanliness in hospitals by simply scanning a QR code using their mobile phones. This addresses a crucial aspect of healthcare delivery, maintaining a clean and hygienic environment in medical facilities. The importance of cleanliness in hospitals cannot be overstated. Poor hygiene and unclean surroundings can lead to the spread of infections, putting patients at the risk of acquiring hospital-acquired infections. These infections can not only prolong the hospital stay, but also increase the healthcare costs. It can also be life-threatening, especially those with compromised immune systems. So by introducing a QR code mechanism, the Rajasthan government is taking proactive steps to ensure that the cleanliness standards are upheld and the patients have a direct channel to report any kind of a lapse in the system. The process is very simple though. When a patient or attendee encounters an area in the hospital that requires cleaning or attention, they can scan the QR codes displayed in that area using their mobile phones. This complaint will be immediately registered and forwarded to the hospital administration for a prompt resolution with a target response limit of minutes. To ensure the successful implementation of the QR code cleaning system, the state government has taken several measures. Nodal officers will be appointed in each hospital to oversee the prompt disposal of the cleanliness related complaints received through these QR codes. Additionally, technical officers or the IT experts will be nominated at the medical college level to provide support and ensure the smooth functioning of the system. And staying with the medical sector and educational sector and hospitals, there is a groundbreaking shift from the traditional teaching methods. Medical schools across India are embracing virtual reality and high fidelity simulations to enhance the training of future healthcare professionals. By leveraging the cutting edge technology, these institutions aims to provide immersive hands-on learning experience that is better to prepare students for the real-world scenarios. This development should be celebrated as a positive step towards improving the quality of medical education. Virtual reality and high fidelity simulations and these technologies offer a safe and controlled environment where students can practice various medical procedures, from navigating breathing tubes to performing surgical interventions without putting real life patients at risk. One such example is the recent partnership between Medicine VR, a software simulation company, and Chennai's college, Sri Ramchandra Institution of Higher Education and Research. Together, they have established a VR skill training lab, providing a platform for medical students, nurses, and healthcare professionals to host their skills in simulated environments. The power of these simulation lies in the ability to mimic real-life scenarios with unprecedented accuracy. High-fidelity mannequins can breathe, blink, and even respond to medications, allowing students to experience lifelike situations and develop critical decision-making skills before encountering the actual patients. Moreover, these simulations offer immediate feedback, enabling students to identify and correct mistakes in real time, fostering a more effective learning process. Medical schools can integrate patient scan reports and specific case studies into the VR simulation, allowing students to virtually diagnose and treat conditions such as tumor, polyps, or even implant medical devices like pacemaker. This personalized training approach is better preparing students to deliver the range of cases they may encounter in the further careers. By embracing these cutting-edge technologies, India's medical education system can pave way for a new generation of healthcare professionals who are better prepared, more skilled, and more confident in their ability to provide exceptional care to their patients. Sticking with the research, for millions of Indians suffering from knee injuries, particularly meniscus tear, finding an effective and long-lasting solution has been a significant challenge. However, researchers from the IIT Guwahati, in collaboration with the University of Animal and Fisheries Sciences, Kolkata, have developed 3 ingenious treatment solutions that could potentially revolutionize the management of this debilitating condition. The knee meniscus, a crucial cushioning tissue in the knee joint, is susceptible to tears due to trauma, sport-related accidents, or simply aging process. Injuries to this vital tissue can make it difficult for individuals to walk, run, or even participate in daily activities, impacting their quality of life. Traditional treatment methods such as surgical removal of the injured tissue often led to a long-term joint discomfort and increase the risk of osteoarthritis. And this is where the regenerative therapies developed by the researchers of IIT Guwahati offer a promising alternative. The team has formulated 3 hydrogel formulations, a blend of silk fibronin and other polymers, that can be used by doctors in clinical settings to treat meniscus injury. The components, particularly silk, are known for their strength, bioactivity, and flexibility, making them the ideal candidate for regenerative therapies. Additionally, these materials are cost-effective compared to the commercially available polyurethane and collagen meniscus implant. One of the formulation is an injectable hydrogel that can be administered directly into the meniscus site through minimal invasive procedures, expediting the healing of smaller injuries. And for large, full-thickness complex meniscus tissue injuries, the researchers have developed 2 3D bioprintable inks that can be used to 3D print the implants. These bioinks are designed to carry growth factor that released in sustained manner, aiding in faster meniscus healing. The implants can be 3D printed to match the specific size and shape of the patient's meniscus, ensuring a personalized and precise fit. The potential benefits of these regenerative therapies are multifold. By promoting rapid healing and regeneration of meniscus tissue, patients can regain their mobility and resume their daily activities without lingering the pain or concerns of developing osteoarthritis. Additionally, the personalized approach enabled by the 3D bioprinting ensures that the implants conform to the patient's unique anatomy, reducing the risk of rejections or poor integrations associated with the synthetic implants. And that's wrap on this edition of Monday Medlines. We have dwelled into crucial health updates and insightful topic. Now it's your turn to join the conversation. So share your opinions and thoughts on the issues we have covered in this hour of Monday Medline, and stay tuned for more exciting updates coming up in your way the next week. And don't miss out on these latest news and insights, so you better hit the subscribe button and ring the bell icon to keep you updated. Your engagement fuels the heartbeat of Monday Medline, so until next time, keep exploring the realms of health and well-being with us. Remember, your health journey is a priority, so take care, stay informed, and we'll catch you in the next edition of Monday Medlines.